What does MEET stand for? MEET is an acronym for the four key elements that demonstrate a provider has evaluated and managed a condition during a patient encounter. M. Monitor. Evidence that the provider is keeping track of the condition. Example, check blood pressure daily, lab results reviewed, monitor A1C. E. Evaluate. Notes showing assessment of the condition. Example, blood pressure stable, improved since last visit, worsening neuropathy. A. Assess/address. Provider actions taken for the condition. Example, increase insulin dosage, referral to cardiology, lifestyle counseling. T. Treat. Active treatment provided or prescribed. Example, prescribed metformin, started physical therapy, provided inhaler. Examples of MEET in action. Hypertension, I-10. Provider note, blood pressure 148/92. Continue lisinopril 10 mg daily. Will monitor and recheck in 3 months. Monitor, recheck in 3 months. Evaluate, blood pressure recorded. Assess/address, continue medication. Treat, lisinopril prescribed. Examples of MEET in action. Diabetes mellitus type 2, E11.9. Provider note, patient's A1C is 8.2. Increased metformin dosage to 1000 mg bid. Ordered repeat labs in 3 months. Monitor, ordered labs. Evaluate, A1C reviewed. Assess/address, medication adjusted. Treat, prescribed higher metformin dose. Examples of MEET in action. Chronic kidney disease, CKD, stage 3, N18.32. Provider note. Asterisk creatinine 1.6, up from 1.4 last month, eGFR 48. Continue losartan 50 mg daily. Advised low sodium diet. Repeat BMP in 4 weeks. Asterisk. Monitor rightward arrow repeat BMP in 4 weeks. Evaluate rightward arrow creatinine and eGFR reviewed, noting progression. Assess/address rightward arrow continue losartan, dietary counseling. Treat rightward arrow losartan prescribed/continued. Examples of MEET in action. Major depressive disorder, recurrent, F33.1. Provider note. PHQ-9 score dropped from 18 to 12. Patient reports better sleep and appetite. Continue sertraline 100 mg daily. Follow up in 6 weeks. Monitor rightward arrow follow up in 6 weeks. Evaluate rightward arrow PHQ-9 score and symptom improvement noted. Assess/address rightward arrow decision to continue current medication. Treat rightward arrow sertraline continued. Examples of MEET in action. Osteoarthritis of the knee, M17.9. Provider note. Pain with weight bearing, mild swelling. X-ray shows joint space narrowing. Started physical therapy 2 times per week, advised weight loss. Prescribed ibuprofen 600 mg TIDPRN. Monitor rightward arrow X-ray results reviewed. Evaluate rightward arrow pain, swelling, functional status assessed. Assess/address rightward arrow physical therapy referral, weight loss counseling. Treat rightward arrow ibuprofen prescribed, PT ordered. Examples of MEET in action. Atrial fibrillation, I48.91. Provider note. EKG shows controlled AFib, HR78. No signs of heart failure. INR today 2.1, therapeutic. Continue ipazaban. Next INR check in 4 weeks. Monitor rightward arrow, repeat INR in 4 weeks. Evaluate rightward arrow, EKG reviewed, HR and INR assessed. Assess/address rightward arrow, continue current anticoagulation plan. Treat rightward arrow, eposaban continued. Examples of MEAT in action. Chronic obstructive pulmonary disease, COPD, J44.9. Provider note. Patient uses inhaler 3 to 4 times/week. No exacerbations since last visit. Oxygen saturation 94% on room air. Continue tiotropium daily. Reviewed proper inhaler technique. Monitor rightward arrow, no exacerbations, stability noted. Evaluate rightward arrow inhaler frequency, oxygen saturation assessed. Assess/address rightward arrow, continued tiotropium, inhaler technique education. Treat rightward arrow, tiotropium prescribed. Examples of MEAT in action. Congestive heart failure, CHF, I50. Note, patient with CHF seen today. Weight up 3 pounds, mild pedal edema. Lasix increased to 40 mg daily. Follow up in 2 weeks. Monitor rightward arrow, follow up in 2 weeks. Evaluate rightward arrow, weight gain and edema assessed. Assess/address rightward arrow, decision to increase Lasix. Treat rightward arrow, Lasix prescribed at higher dose.